wave of the coronavirus, and hospitals in our state are already preparing for round 2. Channel 3 Eyewitness News reporter Caitlin Francis spoke with an official at Hartford Healthcare for details on what's being done to prepare for a worst-case scenario.
Keith Grant, System Director of Infection Prevention at Hartford Healthcare, is joining us today. Hi, Keith. Thanks so much for taking some time to chat with us.
Absolutely. Thank you so much for having us.
So can you talk to us a little bit about the expansion of critical care beds at Hartford Hospital?
Yeah. So, one of the things that we had to do during this whole process, the pandemic, is we were mandated to expand our capability. With this new expansion, we're expanding our critical care capability, and that's a very, very good thing for Hartford Healthcare's impact in the state of Connecticut, in the Hartford community. So that's a huge step forward.
Is it essential to have additional ICU beds to respond to potential further outbreaks of COVID-19?
Yes, I say yes, absolutely. And we've seen that because that was one of the demands. So one of the biggest things, and we're seeing that in other parts of the country right now, is that there's hospital systems that have completely exhausted their critical care capability. So by expanding the space, or critical care space, we've expanding our critical care capability.
And I know a lot of people are kind of bracing for a second wave in the fall. How likely is that we will experience this here in Connecticut?
So if you look at the epidemiology across the country, it's more likely than, it's weird to say more likely than less likely, primarily because we know the virus is still out there. We know what we rely on in order for this to be completely eradicated or to be completely controlled right now is for an effective vaccination strategy, is obviously for availability of a vaccine and effective vaccination strategy. The other thing would definitely be for us to rely on the consistent compliance with all the things that we've spoken about, in regards to proper distance, social distancing, proper infection prevention practices, and universal masking. So is the potential there to see another uptick? I think so.
All right, so, things that we just all have to keep in mind and things that we can do ourselves every day to hopefully keep that risk a little bit lower. Keith Grant, thank you so much for your time and that information today. Take care.